guys, Devin Morgan from Colorado Pain Care Physical Therapy here. Today I'm going to be speaking about hamstring stretching and the difference between hamstring tension and sciatic nerve tension, how to differentiate between the two, and when to seek help. So, many of you know how to stretch your hamstrings. A hamstring stretch is basically a classical treatment for a low back treatment. You go to physical therapy anywhere, they're going to have you start stretching your hamstrings. There are a couple things to differentiate here though. Many of us stretch lying on our back, keeping a straight leg, flexing the hip towards the ceiling. As we do that, a normal hamstring stretch will reach a point where you feel tightness from the back of the knee all the way down to the glutes here. As long as it's in this region where you feel the tension, that's likely a true hamstring stretch. Many people begin to lift their leg, but they stop around this area and they report a stretch all the way down to the heel from this point. So they're noticing what they think is a hamstring stretch, but then they're also reporting a calf stretch. This is not a true calf stretch. If we were going to stretch a calf, we have to put some tension on the ankle. Right now, the only thing under tension would be a hamstring. If you were feeling symptoms down here along the back of the calf as you're doing your hamstring stretch, this is likely sciatic nerve tension. If you have sciatic nerve tension, it's a sign that there's something a little bit off with your lumbar spine, and that's at the point where you got to decide, can I retest the other side and have the same response, and do I have low back pain when I perform this? If any of those answers are yes, you likely need a little bit of treatment to reduce that tension on your sciatic nerve. We test out the other side in the exact same fashion. Many people report the exact same thing. I'm feeling it from all the way down by my butt, down to my heel. The way you can differentiate there is start to mess with ankle motion. If ankle motion doesn't change that, and this stays the same, that's sciatic nerve tension. If we do have sciatic nerve tension, it's a sign that you likely have a disc issue in your lumbar spine. You might have a small protrusion or herniation. Mechanical therapy can relieve that quickly. If you'd like to go over this topic with an experienced clinician, call 303-GOT-PAIN and schedule an appointment today.